Hello, welcome. This is Dr. DiMaio. We're talking about the urinary system, a short and sweet topic without extensive information, but basic information about your urinary system. And we'll be going over the anatomy and physiology of the urinary system. So the urinary system includes 2 kidneys, 2 ureters, 1 bladder, 1 urethra. Sometimes you can see the image, you'll see the left kidney a little bit higher than the right, a little bit lower. And that's just normal anatomy. And on top of the kidney, you have some structures. That's the adrenal gland or suprarenal gland. You have your blood supply to the kidney. There'd be a renal artery going in on both sides and a renal vein going back. So this is the abdominal aorta coming down with its branches of the renal arteries, and this is the inferior vena cava going back up. So you have 2 ureters. The ureters are coming down off the kidney, which go into the bladder, and then there's 1 urethra that empties the bladder. The male and female urethra are a little bit different, obviously. The male urethra is a little longer than the female. Okay, so now we have a lot of stuff on this slide. It's kind of short, cut off here, but again, inferior vena cava, peritoneum, renal vein, renal artery, the adipose capsule, renal capsule, body wall. You have this anterior renal fascia. So if you're opening up somebody from the front, this is the anterior, and you pull up the greater omentum out of the way, you literally lift up the entire peritoneum. See this outline here? This is the peritoneum right here. This yellow. See how it's covering it? All the organs would be inside here. Or a bunch of organs inside here, right? The intestines and stuff. So you literally lift it up out of the way to find this. One of the landmarks is you look for the aorta and you look for the vena cava. So now once you're down here, it's below the stomach a little bit. It's a little bit below the stomach. You can see this fascia covering it. And the fascia covers it, and you're like, where's the kidneys? I can't see it. And you'll see fat around it. So it's kind of weird when you're first dissecting a person to find this. And notice the kidneys all the way up against the posterior wall of the abdominal cavity. It's not in the thoracic cavity. It's in the abdominal cavity. So there won't be any ribs there, basically. It's below the ribs. And then here's the vertebrae right here. Okay, so now what are the functions of the kidney? Basically, there's a lot of functions, mostly associated with your blood, right? And there's maintenance of the pH of the blood and other body fluids. Here's a good one, erythropoiesis, which is the stimulation of red blood cell production through a hormone called erythropoietin, EPO. Erythropoietin is a hormone that's produced by the kidney in response to hypoxia. Hypoxia is low oxygen content, and the cells within the kidney itself help to produce that. That hormone stimulates your bone marrow to make more red blood cells. So maintaining body fluids and also red blood cells will help you a lot, especially if you're hypoxic or anemic. Okay. Also, it functions in the production of vitamin D precursors. You can't make vitamin D without the kidneys. We know vitamin D is produced from sunlight in the skin due to the skin cells getting stimulated, but the kidneys help in the precursors to make that vitamin D. Then the kidneys measuring blood pressure, and we'll talk about those cells that measure the blood pressure, and there are cells associated with the muscular wall around the blood vessels coming in to the filtering system of the kidney, and it helps to maintain blood pressure by releasing renin, and it helps in the renin-angiotensin-aldosterone system for blood pressure monitoring. And then, of course, you know, the kidneys produce urine. And that urine is excreting the things that you don't want to stay in your bloodstream. and the things that are good should stay in the bloodstream. So you're maintaining proper blood volume, not only volume, but the proper constituents in the blood. You don't want that blood to have anything bad in it. So the kidneys are very important for detoxification, especially drugs. They're very important to remove the drugs from your body to help you to get rid of them. So the kidney is a bean-shaped organ located retroperitoneal, means behind the peritoneum. We saw you had to lift it up to even find it. And you'll find it in the right and left lumbar regions of the 9 abdominal pelvic regions. And they're covered by a fascia, which is the outermost layer, which it's made up of dense, irregular connective tissue to protect it. And then there's an adipose capsule for further protection underneath and in between the renal capsule and the outer renal fascia, protecting the kidneys, because they're right up against your body wall and they're very susceptible to damage. The renal capsule is the direct layer upon the kidney. It's like a skin, but it's kind of a tough skin. If you can, almost in the lab, if you have a kidney, you could take your little probe and flick it a little bit. You separate it from the kidney, and it makes like a plastic type of consistency, right? It is formed partially by the visceral peritoneum. Okay, so here's a kidney, and you see on the outside, you'd have the renal capsule, and here, flick that renal capsule right there, right? You can use it's even easier with the scalpel to just take it in between and just flick it. All right, so now you have that renal capsule, and then you're going to have the renal cortex. So here's the cortex, renal capsule, and the cortex is the white going all the way around, right? Just like we had a cortex of other things, right? Okay, now you have a medulla. So the medulla or medullary area has pyramids in there, so they call it the renal pyramid of the medulla. It has this pyramid shaped, right? So this is all medulla here, all through that reddish area, right? That's medulla with its pyramids. And then you're going to have in the pyramid and in all this area, even in the cortex and in the pyramids, you see the blood supply coming through here, right? So we have blood supply coming in, right, and then going out. And so you have arcuate arteries and arcuate veins in this area, the arcuate arteries and the arcuate veins, which are tiny, and that's the extension coming in. And then you're going to have interlobar arteries and veins, which would be in between, right? And then you're going to have segmental arteries, which are a little bigger, coming into the segments like that. Okay, I'm going to erase that for a moment so it's a little clear. It gets a little messed up there. Let's erase all this stuff for a second. Okay, so now we also have these things called the calyxes or calyx. So you have a calyx is actually draining the filtering system, the nephrons. And the nephron has many structures associated with it, and then it comes down into the calyx, which is, like I mentioned the other day, it's like a little minor tributary. So you have a minor calyx, which is a small stream or a tiny waterway. So the minor calyxes are going to come in to this area. And then you have a major calyx, which is going to be more in this area. And then you have the renal pelvis, which is like a reservoir. So you have a stream, river, and reservoir. And then that pools, and that's going to empty down through the ureter, and it's going to go to your bladder, right? Okay. So you have a renal capsule, just in review, renal capsule, renal cortex, renal medulla with its pyramids, renal columns, minor calyx, major calyx, and renal pelvis. So as you're looking at the kidney, you take this checklist, maybe put it alongside of it, and make sure you can identify each part, especially for lab, right? And understanding the function. So the hormones in the kidney, the blood volume and blood pressure are key. The kidneys are an important organ in the homeostasis of blood pressure. They are filtering the blood of the body, and in the process of filtering it, it requires higher pressure than in the systemic pressure. So there's structures there to ensure that you have a higher pressure coming into the filtering system. And within the kidney, we discover the basic structural functional unit of the kidney. The basic structural functional unit of the kidney is what? It's the nephron. So you can fill in that blank. That would be the nephron, right? I can't write too well. I'll put P, nephron. So you know what I'm saying, the nephron, right? Boy, I sound like Biden. You know what I'm trying to say, right? So you have the nephron has several components. One is the glomerulus. And that's the blood vessels coming into a cup. It's like a capsule, right? Which are actually, these are the glomerulus are actually specialized capillaries that act like a filter. And we'll talk about that. And then as the blood is coming into that glomerulus, which is in a cup, there's a juxtaglomerular apparatus, which is made up of cells. And this is the part of the nephron that has cells that can release renin in response to low blood pressure. Also, there are cells within there that can release EPO. EPO is what? Okay, we'll talk about that. That's erythropoietin. But the cells that really do that are inside the kidney. So in the juxtaglomerular apparatus, we have cells that are associated with the renin for that blood pressure level. Once the renin is released into the bloodstream, it gets converted into angiotensin 1. And then when that arrives to the lungs, it's then converted to angiotensin 2. And that's using an enzyme called angiotensin converting enzyme. So renin is produced by those juxtaglomerular cells, but those juxtaglomerular cells are also monitoring the pressure. Prior to releasing the renin or any other hormone, they can stimulate and cause muscles to constrict. Angiotensin 2 can further raise blood pressure by stimulating vasoconstriction throughout your entire body. So you have muscles, vasomuscles around the blood vessels that can constrict to increase pressure if it's a little bit low volume right away, like a quick response. And then you have those juxtaglomerular cells that can release renin that go through the system and create a long-term effect to raise blood pressure by causing vasoconstriction across the entire body. The EPO is associated with blood volume, and that's going to be produced inside the cells, inside the kidney. There are cells that will produce that hormone, and EPO stimulates blood volume by stimulating erythropoiesis. So when the kidneys experience a reduction in blood pressure, they secrete hormones. One of the hormones released by the juxtaglomerular cells is renin. The renin is released by the kidneys, becomes angiotensin 1 and then angiotensin 2, and it causes vasoconstriction. That vasoconstriction we're talking about is throughout the entire bloodstream, in your entire circulation. And a lot of times people have high blood pressure, they're giving a medication to cause vasodilation. Also, the kidneys are associated with vitamin D because when the skin is stimulated by UV rays, it converts cholesterol within the cells into vitamin D precursors. The precursors enter the blood and travel to kidney where they're converted to vitamin D. Okay, so now the nephron is the structural functional unit of the kidney. So here, this is looking at an entire nephron right here in a very quick look. These are tiny microscopic units found in the kidney itself. And the blood is coming into the kidney. We saw how you had the main renal artery, and then you had the interlobar arteries, and then you had the arcuate arteries, and then these tiny capillaries are going to come into the glomerulus. And here it is. This is an afferent arteriole coming in to so I said tiny arterioles coming into this cup. It's going to be coming in here. The blood's coming in here, and then the blood is going to be going down through these kidney tubules. This is the loop of Henle, and back up, and then this will form into urine, and the blood also goes back through the bloodstream. So you have a blood flow into this and a blood flow back out again. So that's what you're seeing here. And then this is the collecting portion. This is the proximal tubule of the collecting tubules, and that would be right here. Let me just erase this so you can see it clearer. Okay, so let's do this, and let's make it urine. So the urine, there's gonna be blood coming through it, and then the urine is gonna be produced, and the urine's gonna go out. But you also have blood coming in, right, first, and it's actually blood as it's coming down here, and then it's filtering back. You'll see surrounding this will be a whole bunch of capillaries surrounding that. And so there's an exchange between this tubules and the capillaries that we'll see. But before we even talk about well, we won't even talk about this part here. We're talking about this part right here at the top where the glomerular capsule is. Inside is the glomerular vessels. This is a cross section, right? So you have blood coming in as the afferent blood vessel coming to it, right? And then the blood going back through your systemic circulation is the efferent arteriole. Afferent arteriole coming in, I said tubule, I meant afferent arteriole coming in, efferent arteriole going away. Now, let's pay attention to something here for a moment. This entire thing is called a nephron. So the function of the nephron is to filter the blood. Then you have reabsorption. The reabsorption is occurring all along this pathway here because it's surrounded by capillaries all around it. So some stuff is getting reabsorbed back because you want to make sure the useful substances stay in your bloodstream. You don't want them to go into your urine, right? And by the way, if you had a urine test and you had blood in your urine, that's considered to be a problem, and it's usually associated with an infection or trauma. And so if you had an infection, if you have a nephritis or damage, and nephritis is inflammation or infection of the nephrons. If you have this infection, it could break down the cells around there, and then blood is going into your urine, which we don't want. So you want the good stuff to go back into the bloodstream. So that's called reabsorption. There's several things that are going to be occurring there. And so you want that glomerular filtrate that came in, you want the good blood to stay. So that surrounding these tubules are capillaries all around it. You don't see it in this picture. And then you want the removal of the waste to go into the urine. Okay. So here is the nephron again. And now this is the beginning of the nephron called the glomerulus and the glomerular capsule. Another name for the glomerular capsule is Bowman's capsule. So this capsule surrounding it is also known as Bowman's capsule or glomerular capsule, right? And now you have blood vessels coming in. We said we had the afferent coming in at a high pressure. And then it's actually, these blood vessels are capillaries within, but notice it has something on top of it, right? So it has podocytes. Podocytes are cells that have like finger-like projections. See, it looks like fingers wrapping around it. And filtration slits. So the blood's coming in at high pressure. What type of capillary is it? Notice these tiny holes. What type of capillary would that be? What capillaries have tiny holes in them? That's a fenestrated capillary. So the capillaries that are inside Bowman's capsule or the glomerular capsule are all coiled like a ball of capillaries, and they're all fenestrated. It's a fenestrated type of capillary. Remember, we had 3 types of capillaries, and one is fenestrated, it has kind of tiny holes for filtration. And so now you have a special cell on top of that with these cytoplasmic extensions called podocytes, And the podocytes are wrapping like finger-like projections, and in between each one, there's a space called the filtration slit. These tiny little feet, hence the name podocyte. So understanding the blood supply to the glomerulus before trying to understand filtration is important. The afferent arteriole brings blood to the tuft of capillaries called the glomerulus, and the efferent arteriole carries the blood away from the glomerulus. The afferent arteriole is much larger than the efferent. It allows for greater amounts of blood to enter the glomerulus than connects it. This allows pressure within the glomerulus to be greater, producing good filtration. There are cells called podocytes that surround the capillaries of the glomerulus. They have these things called pedicels, which are extensions of the podocyte. They wrap around the capillaries and the podocytes, and the capillaries with the basement membrane form the endothelial capsule barrier. So the endothelial capsular barrier, that's what this is talking about right here. It has fenestrations at 70 to 80 nanometers. Remember, a nanometer is very tiny. It's 10 to the minus ninth. Very tiny pores within the glomerular capillaries as well, because they're fenestrated, right? So these are those little tiny pores are 70 to 80 nanometers in diameter. There's a basement membrane, right? And then there's the pedicel membrane that forms a filtration slit. So it's quite an elaborate filtration system. Here it is again. So you have the large afferent arteriole coming in. It's a ball of capillaries that are all fenestrated with these tiny holes. And it has the podocyte with the slits, filtration slits. So the pressure comes in and pushes out, tries to push out the fluid and keep the cells within the blood so that it goes back to the efferent. You don't want to lose blood cells. That would be a problem, right? Okay, so filtration, you want to filter everything except the formed elements and the platelets. So that enters in, and then it's going to be reabsorbed eventually. So when the blood comes in with high pressure, you want to keep the cells, and those cells stay within the bloodstream. And then this filtration that's coming through has the plasma with its good and bad stuff, and you want to maintain the good stuff. You don't want to lose the good stuff. So it's an elaborate system of allowing good stuff to stay in and the bad stuff to go. So as the filtration is coming down, you have good and harmful substances within the glomerulus. The nephron will eventually reabsorb the beneficial substances back into the blood while the harmful stuff is being put in the urine. I think I repeated myself 100 times on that. So this shows you a general schematic. So you have these afferent arterioles coming in, right? So this is from those interlobar arteries. Remember the interlobar arteries, you have the renal artery, goes into the segmental arteries, and then the interlobar interlobular arteries, and there's an afferent arteriole coming off the interlobular artery coming into this glomerulus capsule of the nephron. This is just the beginning of the nephron, right? And then you have the rest of the renal tubule containing the filtrate. And there's capillaries surrounding it where there's going to be an exchange of materials based upon the concentrations. So here's the exchange. There's different parts of the renal tubules. There's a proximal convoluted tubule, and there's a distal convoluted tubule. There's a loop of Henle at the bottom, and then you have the collecting ducts. So what's happening according to all these? I highly recommend you take the next image that you're going to see in a moment, and you put this up against it, and as you go through it, you see what's happening at each level. So in the proximal convoluted tubule, which is the beginning of it, it doesn't really represent it with a name there, but you'll see it's proximal, close to the glomerulus. So if you're looking at the glomerulus, the top of the cup, you'll see right next to it a proximal, is like a convolution, like a folding of the tubules very close to the glomerulus. That is the proximal convoluted tubule, where most of the H2O and beneficial solutes are reabsorbed into the bloodstream surrounding it. So there's capillaries surrounding that. The solutes, such as glucose, water, and soluble vitamins and minerals and amino acids and minerals, are also reabsorbed at the proximal convoluted tubule. So most of your water and beneficial solutes are reabsorbed, such as glucose, water, soluble vitamins, amino acids. You don't want to lose that in your urine. They become reabsorbed at the proximal convoluted tubule. Then as you go down, there'll be a loop of Henle at the bottom. At this loop of Henle, you'll see responsible for the water reabsorption, and this is where this highly technical term, by the way, the counter current mechanism of water reabsorption. Now, think about it for a moment. You have a sink, and on the sink below, you have that thing comes down and it loops back up, right? It's the same idea. But imagine at the bottom of the loop of that pipe underneath your sink, it can actually have blood vessels surrounding it. And as the water washes down, it creates like a gravitational pressure. It kind of sloshes a little bit. So it creates a counter current. It's going one way and then it comes back up and back down again, right? You can imagine that with a loop. If water comes down, goes up a little bit, whoa, it goes back down. So that counter current mechanism is the major site for water reabsorption. It's a major site for water reabsorption. Most of it is reabsorbed in the proximal convoluted tubule, but because of this counter current mechanism where the water sloshes down and back up, you get reabsorption of more water again. And then there's a distal convoluted tubule, and that's where the sodium and chloride reabsorption occurs. This is also the area that's influenced by parathormone, and it's the major site for calcium reabsorption. Okay, so now on a test, you need to know the differences between these, right? And then the collecting ducts are a small amount of reabsorption of beneficial substance, such as sodium bicarbonate ion. So you can picture this, but also on a written test, a lecture exam, it's going to be put in question terms, you know, true or false, multiple choice. So you have to be able to make your own questions up to really grasp this. You know, so you can make, once you've studied this and memorized it as much as you can, then you make questions up, multiple choice and true or false for each one to help you study that. Because on the lab test, it doesn't matter visually. I mean, on the lecture test, it doesn't matter visually. The lab test, it matters visually. But I'm not going to ask detailed questions like this on a lab test. You're just going to have to identify these parts, right? So here's an image showing you the beginning right here. So this is the glomerular capsule right here, right? And there's a space in between the capsule, and these are all the capillaries of the glomerulus, three-dimensionally. And remember, it had those filtration slits from the podocytes on top of it, right? And these are fenestrated capillaries, so the blood comes in there. And then here is the renal tubules. So there's a proximal convoluted tubule. That would be the proximal. And it shows you the cells lining the lumen here. Okay. And then you go down the descending limb. And then there is a loop of Henle. Here's your loop of Henle. Okay, and you see, it talks about that. It doesn't say counter current, but that's where the counter current is going to be going up and back down. So this is the ascending limb going up. And then this is the distal convoluted tubule right here. So it talks about the distal convoluted tubule a little bit right there. And then the collecting tubules, that's the rest. They're large and they're coming down. So I'm going to show you another image. So this is showing you as the blood enters the glomerulus. So here's the afferent arterial blood coming in, bigger and wider, higher pressure. And notice there's cells surrounding it. There's muscular cells that can constrict as well and cause compression and cause the blood pressure to get higher. And then you have these juxtaglomerular cells that are monitoring the pressure. And you have these other cells called the macula densa, which also are monitoring the pressure. So this is in the ascending limb, and the distal tubule. The macula densa cells are also monitoring that pressure. Okay. So here again, you see that macula densa right here of the tubule. And then here, you're seeing these are called mesangial cells. These are also measuring the pressure, and they're the ones that are going to be producing that hormone, the renin. And here you see the juxtaglomerular cells here measuring the pressure. Okay. So now, once the nephron produces the urine, it's going to drain into the bladder through the ureter. So here's the kidneys in orange or red. This is the adrenal gland, suprarenal gland. There's the renal artery coming in off the abdominal aorta. Here's the inferior vena cava collecting the renal veins into the vena cava. But you have another tube coming out of the kidney from the hilus coming down. That's your ureters going into the urinary bladder. Okay. So the urinary bladder is a hollow organ that can stretch because it's made up of transitional epithelium. That's a type of epithelium that can stretch and change its shape. And the urinary bladder carries the urine out to the external environment through the urethra, through a process called micturition. That's the term for urination. If you want to be, a wise guy and you're hanging out with your friends and you need to go use the bathroom, and you can say, "Excuse me, I must go micturate." And it'll let everybody turn their head like, what? Micturition is urination. So now when you look at a bladder has the ureters coming in. Okay? As the ureters come in one side first and the other from the other kidney, they come into the bladder in this area called the trigone. So the trigone has the two openings for the ureters coming in right here. And then an opening down here for the urethra. So it's going to drain into the urethra. There's a muscle that helps you to release that. Okay, and the urine comes down. This is showing you a male, and this is showing you a female, just like we talked about in the lab. Before going into the penile urethra, it has to pass through the prostatic urethra. So there's a shared space for urine, and also the prostatic fluids and the semen would come in here. And as we'll see when we talk about the reproductive system, there's a purpose for allowing the urine to go through too, because in the male, the urine cleanses the tract before ejection of the sperm and the prostatic fluids. So it actually, prior to ejaculation, the urine can cleanse the tract. Okay, in the female, the urethra is much smaller, but they both have a urogenital diaphragm controlling the release of that urine on either side. See, urogenital diaphragm, which is a muscle.